And I'll just go ahead then and get us started. Okay. So, welcome to our Twitter space. This is a Twitter space dedicated to the Developer Health Fund launch, which is a new initiative that we just launched at G2I. For a little bit of background on G2I, G2I stands for Good to the Internet, if it's an easy way to remember. And we're essentially a double-sided ecosystem or marketplace for developers and tech companies. And we are the first developer marketplace that prioritizes developer health. And I believe we're the only ones. And so, one of our offerings that we're launching, not just to the people in our developer collective, but to anyone in the developer community worldwide that would like to apply for it, is our Developer Health Fund. So, really quickly, I want to get into what the Developer Health Fund is. So, this fund is it's like a reserve or an allocation that of money that we put aside to support the physical, mental, and emotional health of the global tech community of software developers or anybody who really works in tech. And these allocations for the fund can be used for anything from paid time off if you're a freelancer and you don't get PTO, to couples counseling, to surgery or therapy, childcare services, prescription medication, really anything that you feel would improve your mental, physical, or emotional health and just help you get better. And I'm going to give the mic to Gabe in a second because there is a very strong purpose behind specifically the Developer Health Fund. What what the amount that we're launching it at is $22,000, and I'll let Gabe go into that more specifically again. So I'll introduce you now, Gabe, the founder of G2I. Welcome.
Thanks, Michelle. It's great. So great to be here. It's been a really long time that we've been talking about launching this fund and kind of planning the launch. My story, the long version would take us the entire time to to cover, but the short version of my story is, I was chronically ill. I had mold toxicity from like black mold in a water damaged building. I had mercury poisoning from eating too much swordfish through a restaurant I worked at through college. Um, and I was dealing with work addiction at the same time, and burnout, which I've seen all too often in tech. And it was on my 33rd birthday in 2018. I remember I was floating in a pool here in Florida. It was my mom's little pool over in Sarasota, and I was miserable. I remember just having headaches and massive headaches, fatigue, just so tired every day, could barely think straight often. And I remember, I would sleep on the floor of my office and like get up, do a little bit work, go to sleep. I'd sleep all through the weekends. It was just miserable, and my marriage was suffering, and my kids weren't seeing me often. And that weekend, I realized that I needed to ask for help, and we found a doctor that I thought I could trust. Um, in the middle of that process, we found somebody much better, Dr. Craig Tanio in Hollywood, Florida. But it was still a lot of money to raise, a lot of cash to get better. And so my wife helped me put together a GoFundMe, and I put it on Twitter. That was October 22nd. It was actually on my birthday, 2018. And I'm just looking through, like, that date changed my life. I'm looking through, there's 546 retweets, It's not like I have that many followers. Like Dan Abramov, kind of, sent it out to a bunch of people. Tejas sent it out to a bunch of people. Vlad, the founder of Webflow, reached out internally into his company, passed it on. Jamin from Infinite Red. I mean, there's just so many people in the ecosystem that supported that one tweet and that GoFundMe, and it changed my life. That we raised $22,000, $22,450. Um, and that's what, over the last couple of years, I used that money to get treatment, and it was amazing. I got healthy. It took me almost 2 years to get healthy. It was a long trek back up, and it was also an emotional journey. Getting sober from work addiction, um, getting the physical help that I needed, and also starting counseling, marriage counseling. My wife and I celebrated 7 years of marriage on Monday, and we were at the brink of not being together anymore, and putting our kids through that. And if that money hadn't come in, honestly, and I'm looking here, Brandon, from Flight Control, Emily Freeman, Justin Lane, Mike Grabowski, Mark Thomas, Yves from Code Sandbox, Atticus White. I mean, Henry from Babel. I mean, uh, I I could name 300 other people that gave. Someone sent half a Bitcoin at the time. I wish I didn't cash that out. But the point is that I went to the community, this development community, the open source community, for help, and they blew me away with this amount of money. And so I've used it, gotten better, and we're in a position at G2I to give back. And so that's the story. That's the brief story, and that's where the dollar amount comes from. And this, for us, it's just the start.
So to launch the fund, we're starting out at G2I with $22,450, which is the exact amount of money that was raised on your behalf to help you get well all these years ago. So this is really a full circle moment of bringing things back around, and helping others, paying it forward were the words that I was looking for. Paying this forward back into the community that helped you. And so I wanted to ask you what it means to give back to the community.
Um, well, I think the greater mission that we're on at G2I, what we've been working on is, how do we help software developers and other people that work in tech increase their mental, physical, and emotional health. And we're working towards the MD that helped me, having him join our board, and actually offering services directly to the industry. Um, but as a starting place, like this fund to have, which I would hope that would grow, like that we'd be able to give more money each year, that we'd have other companies that would start donating to this fund, that it become kind of its own vessel for being a place of care, to the engineer. We recently did a poll. I think there was, what, 650 developers that answered the poll. And I think 66 of them reported to struggle with burnout in the last 12 months. Um, it was, it's like, it's too high. And so we're also developing a curriculum and a community around burnout recovery and prevention, and also just increasing your overall performance if you're not burned out. Um, Restful work. Um, so there's numerous activities and things we're thinking about. And I think the developer fund was the most obvious one. Just give money, give a place for people who need counseling, or they need help with a surgery or a medical issue, or even time between projects, or if they got fired, you know, um, doctor's visits, daycare, whatever would help you with your mental health, your physical health, or your emotional health. So that's a for us a starting place. And for me, I wanted to give directly back in the way that was given to me.
Yeah, and I think that's amazing because I feel like everybody's journey, there's a lot of things that we have in common in the tech industry, and there's a lot of things that we can like share stories about or experiences, but ultimately at the end of the day, our journeys are very unique, our needs are unique, and so I think that it's good that we just have this place where you can go and kind of say like, I don't need you to really do anything for me. I just need like a little bit more resources to help myself get to this place that I want to be rested and healthy. And I know how I want to get there. Because like I said again, everybody's story is a little bit different. And so I also wanted to, yeah, mention that of course AMA ask me anything, ask us anything. So if you have any questions about the Developer Health Fund, how to apply, when the distributions are, what you can use it for, feel free to request to speak, and I'll accept that. Or if you just want to talk about the fund, if you have any thoughts or opinions, just this is really an open space. So feel free to request to speak. I will accept it. Um, Go ahead,
And
Gabe.
I just want to mention something that you were talking about, Michelle. This idea of, like some people have an idea of where they need to go and how they need help, and often in tech, we can make more money than in other areas, in other industries, especially, if you're working as a software developer. But that doesn't mean that you can pay for all of these things. That's just the reality, and there's no shame in asking for help. Um, I've had a really enjoyable career, um, and at the same time, I wasn't equipped, in 2018 to take $20,000 out, in a matter of 2 months, to do what needed to be done for me, So it's there's nothing to be ashamed of, to whether even if it's just some counseling that you just can't fit in, that you've always wanted to try, or that you really are about to experience burnout and you need some time off. Those are You don't need to be where I was to ask for help, in that place where you're just desperate. You can be a place where you just need some help, and that's perfectly reasonable.
Yeah, absolutely. I couldn't agree with you more. It doesn't have to be like dire situations, it can be, helping you avoid that place of burnout too. So I wanted to just give a quick recap. We launched yesterday with G2I, the Developer Health Fund, which is a reserve allocated to supporting the mental, physical, emotional health of software developers and tech workers. And this fund, you can apply to this fund on the website developerhealth.org. Um, so when you apply to this fund, all you have to do to apply is share with us your contact information, share with us like a LinkedIn profile, just as a way to just lightly confirm who you are, the purpose that you want to apply for, so the reason for applying, the amount that you are requesting, and why, and then besides that, just anything else that you'd like to share is completely up to you, but we're trying to keep it as simple as possible, to kind of like minimize this any barriers in the process. Right now, who's eligible to apply? Anyone, any developer, tech worker from around the world, excluding Russia. Unfortunately, of course, because of the current events, we can't work with transferring money to Russian bank accounts. But anywhere in the world, tech workers can apply to this. So if you're outside of the United States, that's perfectly fine. So again, feel free to ask any questions if you like. Okay, that's all right if there's no questions either. So I'm, oh, so Anu, I'm gonna accept you. Hi, welcome.
uh, Developer Health Fund, and it sounds great, especially after hearing the story of Gabe uh, and his struggle and how the community helped him. So, one aspect about which I'm curious is um, like, what is the association of money related to mental health issues or struggles regarding this this reserve and the software developers? So maybe you can share about the mental uh, aspect of that. Sorry, mental health issues aspect of that.
Sure. Yeah. I mean, um, from my vantage point, that's a big part of my story is like mental health issues that I've struggled with, specifically addiction. Um, and so we absolutely support that. Like if we have it listed on the examples of aid the fund provides on the website, whether it's counseling or therapy, that's needed or some other avenue, towards, improving your mental health. And that includes, like we said, paid time off. If you just really are burned out and need some paid time off, like that's something that we want to respect and honor, or if there's other avenues that around mental health that you think that you would need. I don't know. Maybe it's like paying for some sort of treatment center. If it's a substance abuse or other type of treatment center. We talked about wellness retreats. I recently met somebody through the hiring process that went to a retreat where she was burned out from work, and they actually kind of like took devices away. It was like almost like a drying out place from technology, and she's re-entered the workforce, seems to be doing well. We'd honor something like that. So actually, we're interested in trying to start some sort of burnout recovery type of like retreat, having like an actual place to go to. So yeah, we strongly support the mental health side, with developer health, the fund. And developer health, we've come to define as, the physical, mental, and emotional health of software developers and tech workers. Um, so yeah, definitely includes the mental health side.
That answers my question. Thank you for that.
Yeah.
Just one suggestion, if I may add, is that like treating the issue should also involve, like, as a community we can also put up some content, and as you said, like, you'll be figuring out retreat centers for these kind of issues. So for similar issues we can also like put up some content as a community to recognize and stop people from going that route from the very beginning, so that uh, the stage doesn't hopefully doesn't come that they would need to you know go that way.
Yeah. Michelle and I couldn't agree more. We think it's one of the most underserved areas in tech. When you talk about like burnout prevention as an example, like you don't really see that in like uh, coding boot camps, or like if you're getting a computer science degree, like that's not really taught. That's not the first thing you learn, in this industry. And it was tough for me, because it's overwhelming, all the things that you don't know when you first start in tech. You feel like lost and an imposter, and you just want. I was very hungry, to learn. I still am, but I wasn't taught, boundaries, and I wasn't taught how to like pace myself and all these other things. So Michelle and I have been writing something called Restful Work Operating System for the last 6+ months that addresses that, and we're bringing in professionals as well, like a medical doctor, potentially a licensed mental health counselor as well, to review what we've written, add to it, and then we're going to beta test that in probably a group setting at some point before we launch it to a wider audience. So yeah, we're with you. Like content, curriculum, education is needed in that area. Couldn't agree more. I think Tech God,
The,
you're up next.
this is Peter. Hi, Peter.
Hey, how's it going? Hey, Gabe. Hey,
Good.
Michelle. Long time
Good,
since React Miami.
good to see you,
I
man.
know.
Always
I
glad to
still
be
I still
around
have to
that.
take you rock climbing, man. I have it on my list.
Definitely, definitely. Let's give us some time. My fingers,
Okay,
my
all right.
fingers might need some space for that. But I had a question about the fund, and you probably already covered it. I joined in a little bit late, but just understanding the overall success criteria of the fund. Like, what do you see as overall outcomes for, I guess, the various types of um, the submissions that you would accept? Like, what are you seeing as like change with the fund?
That's an amazing question, Michelle. We're when we thought about success criteria, we've kind of gone pretty broad in that. But what are your thoughts on success initial success criteria for like the first 6 months?
Yeah, it's a good question because it's really tricky. Um, we're not intending to collect any medical information from anyone or have like any documents or anything like that. So it's like definitely in our first run, there's like a high, like it's like a high trust situation in that we have these applications, these applicants, and basically because we're not going to talk to any doctors, we're not going to look at any medical forms, we can basically just do essentially surveys and communications with recipients and essentially ask, if they were able to get what they needed with the fund, did they feel that it helped them? And then to be quite honest, and I think Gabe and I are on the same page with this, it's not really, I don't really want to say that we are necessarily super interested in like imposing ourselves in the middle of this. It's simply to give back. So Gabe talked about his story where the idea for the fund came from, and that's that he had a GoFundMe that supported his health journey. And in that same regard, when people donate to a GoFundMe, it's with the trust that Gabe will use this for what he said he would, and he got better, and we can see that now. And that's essentially really what we're looking at from our side as well. It's not that we want to like, have all of these like testimonials or need people to like record videos or anything like that. We mostly just want to be able to ask like, hey, did this help you? And then just hopefully hear a yes.
Yeah, I'd echo that and just say um, that it changed my life, and it changed the life of my kids, and it changed the life of my wife in the sense that she has a husband now that's like actually able to help. We're going on vacation tomorrow, and I can actually be present instead of sleeping through our vacations. Actually, I didn't really take them before. It's affected the company that I work with because I'm a better founder and leader. And like this has had like this trickle down and trickle around and trickle out effect of the joy in open source that was given to me through this money has now been able to spread in other directions. And so, if we're able to change 10 people's life, 10 people's lives through this $22,000, like deeply, like impact them in a way where they're like, wow, I didn't know where this was going to come from. And now I could get that surgery or pay that part of it, or, we started counseling and, I got 10 sessions and figured out the rest. And that would be a huge win. Will our success criteria change over time? Maybe. Like, I think it really depends on. Uh, we would like to have more members on the like kind of like the board that is deciding how to distribute the funds. We'd also like to see other companies or organizations, contribute to the fund. And I think when those things happen, they're the oversight will become more specific, but like Michelle said, right now, day one, we're just trying to distribute the money, uh, in the areas of need and start there. Getting it off the ground was the first step.
Awesome. Thanks. So, oh, go ahead, Peter. Were you going to say something?
No, I was just gonna say thank you. You definitely answered that thoroughly. I appreciate y'all. I had a, if you don't mind, I had a follow-up question, and I know I missed you in Atlanta at Render. It was so many amazing
I
people there.
know. Every time I walked by you, you were like in the middle of a very intense conversation, and I was like, "Okay, wait, I'll come back around later." And then it was like again, and I was like, "Ah."
Oh my gosh, definitely. We'll see you next time for sure. Just so many people, and I'm so glad I was even able to make it there.
And
What?
you didn't just make it there; you were a speaker there.
Yeah, exactly.
Yes.
That was a major just after COVID. That was my first talk there. Um, but I was actually interested because you're really big into Web3, and I'm sure like you being in Miami, you can kind of see the disparities with like income and the new sort of tech wave for like people coming from the West to Miami, driving the housing prices up. And so I'm wondering if any of this, like developers running into issues with like dealing with like homelessness or dealing with like having support with like or potentially using this as a to for down payment assistance to actually get a place, because I've known a lot of bootstrap founders who had to get displaced or move elsewhere away from sort of the smart part of the city or the areas where you would bump into more people that are in the know or in the tech space actively organizing meetups and so forth. What are your thoughts on using this as potentially as like a down payment assistance on like getting someone's first property for a
Yeah,
moment?
I am. Yeah, I empathize with this a lot. As a born and raised South Floridian myself, I've seen the landscape change dramatically over the course of my life, but not ever in the way that I've seen it go in the last 2 years. And I know it's been very exciting for a lot of people moving into South Florida, and even a lot of people that were already living here, but it's also been unfortunately like a very dramatically negative experience for a lot of people that were already here as well. And we do definitely have as a suggestion on our website that you can use the fund. You can apply to the fund for loan assistance, whether that be for loan assistance that you need for housing, or if you need loan assistance for something like student loans. I think we basically just said, like, these are examples of what you can apply to the fund for, but there are no hard lines around it. When it comes to applying to the fund, it's not necessarily for us to say that this counts and this doesn't count. I would just say that, just describe how this would support your mental, physical, or emotional well being or health. And that's what matters in the end, is how is this going to help make you feel healthier. And living cost of living is absolutely critical in health.
Thank you so much. That's amazing.
Absolutely. So this is an AMA. And it's about our developer health fund at G2I that we launched, just as a quick recap. And so we were going to keep the space running about 30 minutes, which is where we are now. But we also are happy to stay for any questions or conversations or discussion around the fund that anyone wants to have. So if you'd like to request to be a speaker, I will accept that. And again, I'll just quickly say, like, our developer health fund, developerhealth.org. dfhf.org is the website that you can go to find out more information about the fund. You can learn, like you can look at the FAQs, you can read Gabe's story that inspired the fund, and you can of course apply to the fund and even donate there as well. Of the initial amount from the fund is the $22,450. That's all from G2I, and that's the same amount of money that was raised for Gabe when he needed it several years ago from the tech community. And so we do intend to keep putting back into this fund, but we also want to open it up to anybody that wants to donate or to contribute to this fund. If they want to pay it forward as well, they're welcome to do so. So there's tons of information on the website, and most importantly, the application to apply. So I'm just gonna really quickly, again, if anybody has a question. Oh, go ahead, Peter.
Yeah, I'll probably need to just check the website. I'm actually traveling right now, so I'll check that out as well. But would someone contributing as like an LP or as a, you mentioned donation, what would be the tax structure behind it? Like, I guess contributing to the fund, and are there any what guidance around that like you could offer?
Yeah, this is a really good question. So starting off, I'll give a little bit background. I have quite a bit of experience in nonprofit work, and currently the chair of a nonprofit called Code Palm Beach. And from this experience, we decided for the initial launch that we were not going to go through setting up an entire nonprofit branch for the first distribution, not until after we saw how this goes. So we're not really doing like a full fundraising campaign just yet, as we see how the first distribution goes. So this is not like a tax deductible donation. This is not going to a nonprofit. This is going to a separate bank account where we keep the funds separately for the Developer Health Fund.
Thank you.
Absolutely. That was actually right up next on my list of like our marketing team. Alex, who's actually in the space right now, made this like amazing document of points to bring up in the Twitter space before it ended, and that was actually the next question that he had on here for us to discuss. So perfectly timed. So with that said, also as far as getting involved, if you're an organization that wants to get involved or an individual that wants to get involved, you can reach out to contact@developerhealth.org. Gabe and I are really, I would say, like really kind of open-minded about where this can go. Again, this isn't about you know, like a marketing angle. It's about bringing something full circle, and trying to help people the way that we were helped ourselves. So if you have any ideas or suggestions or ways that you want to work together, contact@developerhealth.org. And yeah, I think that's about all of the points. If you want to apply, developerhealth.org/apply.
I just think it's so cool to hear that even the domain name that I bought, like, I don't know, a year ago, developerhealth.org, it's like, it's live. You can actually get money from the fund. It's really special. So I agree that we just wanted to get it out there rather than, you know, set up the whole 501c3 status, and you know, there's a lot of red tape and structure needed for a nonprofit, and that might be the direction one day that we go. Who knows? Maybe it goes in a different direction. You know, maybe it goes towards Web3 or some sort of DAO direction. You know, we don't know. The direction that we wanted to head is to help people, and you know, for many years to come, and that the fund would grow and help more people. And yeah, I just want to take a moment to thank the team Alex at G2I, who put together a lot of this launch, and Michelle, who's done most of the legwork up to this point, and Maybelline on our team, who also helped with the launch. Has been amazing to see. And first and foremost, thanking the people that gave to me. The tech ecosystem is one of the most helpful and friendly places that I've ever seen. To be honest, it's really, really special. It really, really is. I'm grateful to be a part of it in a very tiny way. So thanks for letting me get to be a part of
find
the
it
ecosystem.
Yeah, I just find it so interesting that the domain was only purchased last year. Like, that's such a premium domain. It was available.
Yeah, I agree. I'm like, developer health is a word that that we want to, like, the next generation of software developers. They just talk about developer health. It's just like a thing that they know about. They talk about. There's curriculum. There's education, and I view one day that there would also be, just like developer experience or developer relations. There'd be developer health professionals, that are working across organizations, in organizations, to make sure that their tech workers, their software developers have what they need at a deeper level. Understanding the root problems, is a big deal. When you actually understand what's going on behind burnout and mental health issues, you don't try to treat it with like yoga and snacks. There's nothing wrong with healthy snacks or yoga. It's just that, like, that's like the thing in my head, that it's like these wellness programs just miss the point. That's all. That deeper, more holistic care is needed. So we're trying to do that differently at G2I with our members on our hiring platform and our community, and we're trying to do that differently. We're trying to live it too. Like, I don't want to come up here, and not be living, trying to live a life where I'm trying to increase my own physical, mental, and emotional health. Like, if you ask the people that work with me on a daily basis, like, I really do try to live it, because I've learned it's a glass ball. You drop it and it doesn't come back to you. So there's quite a bit of work here to be done. We don't claim to have all the answers, so we just get to be like fellow learners, but it'd be great to see developer health, as a word, as a phrase, as an idea, permeate the industry, more and more. So thank you to y'all for showing up and asking us questions. And if anything else were to come up, Michelle and my DMs are open, or contact at developerhealth.org. So thank you, Michelle, for hosting us.
Yeah, thanks. And Anu, I noticed you had your hand up, so I didn't want to miss that before we wrapped up.
Hi, yeah. So just a last quick question from my side. So we are considering money as a commodity here to help people, especially software developers. So one question which I had in my mind is, for example, let's say there are some junior developers who are struggling to get into tech industry, and as you might be aware of, it's quite challenging these days, and it can also lead to some stress times. So, so like in terms of, so like can there be time also as a commodity to help, like to provide these upcoming developers for like an intern opportunity or something like that, or is it just focused on helping developers with money when it comes to mental issues, or like I hope
So
you got the
yeah,
question.
yeah, the fund definitely is focused on financial resources, but as far as professional development, which I think what I understood you were asking about, we've talked about this, Gabe and I
Mhm.
at G2I, when we were like like trying to describe or define what developer health is. Does developer health include professional development? Because of course, if you do have like more training under your belt, it can like lead to better
Exactly.
opportunities, which can have a waterfall. like effect to it. So we definitely understand it from that perspective, but I'm not sure if anybody here has seen, we do these weekly, or try to do it weekly, maybe more bi-weekly now, developer health Twitter spaces. And we had a good number of conversations with like just the general tech community on Twitter about like, what does developer health include? So when Gabe and I were kind of trying to figure out where we should focus our efforts in developer health, we didn't just kind of decide on our own. We talked to a lot of people using Twitter spaces, just like we are right now. And yeah, there's definitely a side we absolutely see the need for the professional development and the value. But then on the other end, it felt a little bit too ambiguous at the moment while we were getting started. So there may one day be something around professional development services. We were even looking at creating courses ourselves around like React Native, like helping React developers learn React Native, something like that. But in the early stages of just launching developer health as kind of like a concept and like our first offerings, we felt that it was a little bit too ambiguous. And on the other side of it, what we heard from the tech community on Twitter was that there was this other side of it that felt like if we were doing professional development services, that we would be working in the interest of employers and not of the developers. So that we were, which was a really interesting side to hear, that we would be, yeah, like again, it would be kind of almost paying like more lip service to the developers, or kind of treating it like a quote wellness program instead of like actual health solution. And I think because it really just teeter-tottered in both directions when we would have these conversations, we went with focusing on mental, physical, emotional health for the time being. But that's not to say that in the future we won't try and do something with professional development as well.
That makes sense. So all the very best for this, and it sounds great. Thank you for this initiative.
Thank
you.
you. All right. So thank you, everyone. Gabe, is there anything else that you want to add to this Twitter space before we close up?
No, I'm just grateful to be a part of the community, and it's just wonderful to support. So my ask, anybody that is on this AMA now or listens to the recording, is that if you have a chance to share this with somebody who might be in need, please do. Like, just because we've launched this doesn't mean that we've reached the people in need. So we ask that you'd retweet it or keep it in mind as you kind of do your work and meet people, that you share this with them if you think it might be able to help. And in the future, if you're part of an organization or you have extra funds available, that you'd consider giving in a way that can meet people's needs in our industry. So thank you all for being here. Appreciate you.
Thanks, everyone, and thank you, Gabe. And again, the website, as a reminder, it's developerhealth.org. Applications are open, and we're really excited to launch this. Feel free to give us feedback or reach out to us for collaboration. contact@developerhealth.org. Thank you, everyone, so much, and we'll talk to you again soon.
Thanks, Michelle. Thanks, everybody.